फॉर लिवर. हीमोक्रोमेटोसिस, आयरन बढ़ गया लिवर में, ये भी ऑटोसोमल रिसेसिव है, बट दिस इज HFE जीन ऑन क्रोमोसोम 6 is affected. Again, liver is the first organ to be affected, but this has one feature which is having hepatoma, hepatocellular carcinoma. So विल्सन में कैंसर नहीं होता, हीमोक्रोमेटोसिस में कैंसर होता है. फाइन. In the skin, we have bronze discoloration, right? In the pancreas, because iron goes and it causes bronze diabetes. In the joints, we have arthropathy. Second and third metacarpal joints are to be involved. We have CHF and hypogonadism. But unlike Wilson's, kidney, eye are not involved. Fine. Here, the first of all, the diagnosis of choice becomes transferrin saturation. Serum ferritin भी बढ़ता है, but transferrin saturation is the first marker. IOC here is liver biopsy. So beta, this question also comes. So this you should know, which is the first marker and which is the first biopsy, which is the investigation of choice, gold standard. Okay. अच्छा, अभी कुछ बच्चे पूछ रहे थे अबाउट द गोल्ड स्टैंडर्ड ऑफ टीबी, राइट बेटे. नाउ आपको सीबी नेट क्वेश्चन में आएगा ही नहीं, ठीक है. अब आई एम टेलिंग यू दिस थिंग, आई हैव सीन सो मेनी क्वेश्चंस, कहीं पे भी सीबी नेट है ही नहीं चॉइस, राइट. सो ऑलवेज द कल्चर विल बी देयर, ओके, बिकॉज वो हमेशा गवर्नमेंट में इधर उधर हर जगह किया जाता है. If by chance the examiner is giving you CBNAT in the choice, then आपको mark करना है CBNAT. Otherwise वो नहीं आएगा. So you have to remember the gold standard for TB is your culture. Done? So अब इसमें confuse नहीं होना. Fine बेटे, no doubt CBNAT is better. But अगर वो option में नहीं है तो क्या करें, है ना. उससे अच्छा है, हमारा हैरिसन भी कहता है कि भाई कल्चर इज द गोल्ड स्टैंडर्ड, सो वी विल गो विद दैट. ओके. Treatment is venesection or phlebotomy. We remove that part of some part of the blood which has iron, so that is the treatment of choice. Chelating agents पे तो फार्मा की क्वेश्चन है, कितनी बार रिपीट हो गया. डीफेरिप्रोन ओरल है, डेस्फेरोक्सामिन IV है, एक्यूट है तो वी यूज डेस्फेरोक्सामिन, राइट. If a patient has been untreated, the death is due to CHF, cardiac failure. If the patient has been treated, it is because of the cancer. In hemochromatosis, certain organisms develop which are siderophilic, Vibrio vulnificus, Listeria and Yersinia. Fine, done हो गया. So all these points done. Any doubt बेटे? Any doubt? Any doubt? Okay. Now Budd-Chiari syndrome is occlusion of hepatic veins. 2 or more definition ही आ जाती है. 1 hepatic vein or 2 or more. Most common causes 2 आते हैं, polycythemia vera and paroxysmal nocturnal hemoglobinuria. Fine. First test to be done is the ultrasound and then we do the hepatic venogram. Hepatic venogram is the investigation of choice. What will be the various features? Occlusion हो गया है, so obviously you all know if occlusion is there, one side will be like balloon like, right? So hepatomegaly, ascites, abdominal pain, blood because pressure is rising, right? And you will see a nutmeg liver. Fine bete, let us see the images. So these are the case of Fisher rings. If you see this, आपको एक ही disease आती है, वो है Wilson's. Fine. Next. Okay. See, this is the bronze discoloration of the skin. And can you see the arthropathy? I have made it with red lines. Arthropathy. है ना? Very good. So this is hemochromatosis. Okay. See this. Eagle like, you get this beautiful x-ray बेटे, eagle like, तो या तो ये होगा hemochromatosis, राइट, या क्या होगा, रूमेटॉइड आर्थराइटिस। दो ही चीजें हो सकती हैं और कुछ है ही नहीं। मेजरली यू विल गेट हीमोक्रोमेटोसिस। फाइन, ओके। नाउ, alcoholic liver disease. In alcoholic liver disease, please remember, first thing first जो हमने पढ़ा है वो ही आता है, right? In this, what we have learned is about the AST-ALT ratio. That is very important. Rest बेटे सब कुछ वैसा ही हो जाएगा। बिलीरुबिन हाई, PT हाई, INR हाई, albumin low, albumin globulin ratio is reversed, right? GGT high. Just you have to remember the sixth point, very 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 important, okay? And you have to know about the Zewes anemia. That is the hemolytic anemia. This is a new age question. Hemolytic anemia, which is occurring in the alcoholic liver disease patient. What are the scores? One is the Matri score, which tells us about the prognosis. The other is the Lilly score. The Lilly score means whether it is responding to the glucocorticoid or not. Right? In alcoholic liver disease, we give glucocorticoids to increase life expectancy. Fine. In this pentoxyphylline and glucocorticoids, they decrease mortality rate. If alcohol abstinence, we have to do maintenance, we use acamprosate. What is the most, if they give you what is the most important factor for treatment of alcoholic liver disease, leave alcohol, है ना? What is the most important factor for emphysema treatment? You have to cessate smoking, right? These are all the MCQs. Okay. Next is NAFLT. NAFLT is non-alcoholic fatty liver disease. It happens when somebody has obesity and when somebody has metabolic syndrome, which we have discussed in the important questions, है ना? हमने किया था hypertension, central obesity, उसका एक measurement भी था. Somebody is having obesity and hypertension then, and the circumferential diameters are high, then we say metabolic syndrome is there, hyperlipidemia is there, right? So in that patient, NAFLD occurs, non-alcoholic fatty liver disease occurs. Fine. Now in this ALT will be higher than AST. Both will be higher, both will be altered, but ALT will be on a little bit higher side. Fine. Most of the cases are asymptomatic, and only when you get a lab report done do you see these changes. The treatment is same to as diabetes. You diet, exercise, you give metformin and vitamin E antioxidants. Fine.